Have you ever found yourself stuck in a crowded public clinic, wondering why the wait is so long? Or maybe you've noticed that healthcare costs just seem to keep climbing. Well, we're about to get into all of that. Today, we're diving deep into Malaysia's health white paper. This is a huge 15-year blueprint that's meant to completely reshape the healthcare system that, let's be honest, affects every single one of us. But first, let's get some perspective. For decades, Malaysia's healthcare system has actually achieved some amazing things. I mean, just look at life expectancy. It's been on this incredible upward climb. Think about it. Back in 1970, the average Malaysian lived to be about 63. Now, that number is over 75. That is a massive jump, and it's a real testament to the strengths of the system in the past. But here's the real question, the one this whole white paper is trying to answer. Are those past wins enough? Is the system that got us here really equipped to handle the totally new challenges that we're facing today and the ones that are just around the corner? Because honestly, when you start to look under the hood, the paper makes a pretty strong case that the answer is probably not. The whole system is showing some pretty serious signs of strain. And here is one of the biggest problems we're facing now, the explosion of what they call non-communicable diseases, or NCDs. This chart right here, it says a lot. It shows Malaysia has the highest rate of adult obesity in all of Southeast Asia. And look, this isn't just about weight. It's a major risk factor for a whole bunch of other chronic long-term health issues. And the impact is, well, it's stark. NCDs like heart disease, stroke, and diabetes are now the #1 cause of death in the country. This is a huge shift in our nation's health problems, and it's putting a brand new kind of pressure on our hospitals and clinics. Okay, so if those are the symptoms, the long waits, the rising chronic diseases, what's the actual diagnosis? What's the root cause? The white paper zeroes in on some really deep structural problems that have been building up for years. The biggest issue is that we're basically running two parallel systems, public and private, that don't really talk to each other. And the numbers here are just wild. The public sector has only about 28% of the clinics, but it's handling almost 2/3 of all outpatient visits. You can see how that creates this massive imbalance, right? It leads to an overstretched, burned-out public system and those long wait times for all of us. And this imbalance, it hits you directly in the wallet. Just look at this pie chart. That huge slice, over 1/3 of all health spending, comes directly from our own pockets. It means that when the public system is jammed, people who can afford it are pushed into private care, which can cause real financial trouble for families. And this right here really gets to the heart of the problem, a serious lack of investment. Malaysia spends just over 4% of its GDP on health. Now compare that to other countries at a similar economic level, their average is almost double that. So our system is basically being asked to do way more with way less money. Okay, so the diagnosis is pretty serious. The system is overworked, underfunded, and split in two. So what's the cure? Well, the Health White Paper lays out a really ambitious treatment plan, and it's built on 4 main pillars. And they're really trying to tackle this from all angles. Pillar 1 is all about changing how you get healthcare. Pillar 2 is a big one, shifting the focus from just treating sickness to actually preventing it. Pillar 3 is about fixing the money problem, making sure it's all sustainable. And Pillar 4 is about strengthening the rules and management of the whole system. Let's just zoom in on that first pillar for a second, because it's the one that'll change your experience the most. The whole idea is to move away from our reliance on crowded hospitals. So first, your local clinic, your GP, becomes the true center of your healthcare. Second, that frees up hospitals to focus on what they do best, the really complex, specialized cases. And third, you use technology, like one single electronic health record for every person, to connect everything seamlessly. Now, a massive overhaul like this isn't going to happen overnight. The white paper is really upfront about this. This isn't a quick fix, it's a long-term journey. It's all mapped out as a 15-year road to recovery. The first 5 years are all about laying the groundwork, testing out new ideas, and getting the foundations right. Then, the next 5 years are for scaling up, taking what works and rolling it out across the country. And that final phase is about stabilizing the new system and making sure it's truly built for the long haul. So after all the policy talk and 15 years of work, what does it all mean for you? What would your journey through this new healthcare system actually feel like? The ultimate vision, in the paper's own words, is to create a health system prized and valued by the people. It's about building something that we can all trust, something we feel is truly working for us and our families. So, what does that actually look like? Well, picture this. Your local clinic becomes your one stop shop for most of your health needs. You'd have one health team that gets to know you and your family over your lifetime. All of your medical records, every test, every visit are in one single, secure digital file that you control. And maybe the biggest change of all, the focus shifts from just treating you when you're sick to actively working with you to keep you healthy in the first place.
It's a really powerful vision, isn't it? And the plan is incredibly ambitious. But it's going to take a huge amount of money, real political commitment over many years, and a big shift in how we all think about health. So I guess the final question is the biggest one. Can Malaysia pull this off and build that healthier future for everyone?